Hey everybody, I have reviewed your annotated bibliographies yesterday evening and through today and given you feedback in Blackboard. I'm going to walk you through my recommended process for how to approach the next iteration of this project. The first thing I'm going to tell you to do is go open up part 1 in Blackboard and read the comments that were provided. Make all the necessary changes there, and then pick up part 3 at the end of part 1. So you're going to have one continuous paper. So open up part 1, clean up, make all the changes, and then begin on your part 3. As its own Word document, you're going to keep that in one place. Next thing to do is open up your annotated bibliography and look at the feedback that's been provided. If you have 10 usable articles, then you are okay to move forward and begin your analysis. If you don't have 10 usable articles, then you've been given instructions by me to correct the mistake or mistakes that you've made and make those changes, and then do a second submission in last week's Blackboard site so that I have your revisions and I can make sure that you have 10 good articles before you start the analysis process. Without 10 articles that answer your P code question, your P code question is my intervention better than my standard of practice? If you have not really delved into your intervention and your standard of practice, then you're not going to be able to answer your P code question. You can't answer your P code question with one article on one of those areas, either your intervention or your control. You need to have ample information that says, this is a really good idea, or maybe this is a better idea. Okay, so that's the reason that I've kind of capped you at you got to have at least 10. So if you're in the bucket of you've got to make some last minute changes and resubmit those, you're going to do that next. You're going to email me directly and say, Dr. Hudgens, I've submitted our revisions. Can you take a look and let us know we're good to go? Once you get the green light from me, you can begin to do your analysis for the third step. Now that everybody will be ready to do their third step, let's talk about what that looks like. So either you immediately get to do part 3, or you're going to clean up your annotated bibliography and then join for part 3. With part 3, you're going to go through and do an analysis of your articles that you found. That is not a repeat of your annotated bibliography. What you're doing is you're taking those 10 articles and you're organizing them in a way that helps you make an argument. You're going to compare and contrast the similarities and differences within your concept area. So if your control was based on one topic, then you should have several articles that talk about your control related to your NURS sensitive indicator. You're going to use a section of your paper to say, these 4 articles were related to our control. These 2 articles said this one said this, and this other one said this. You're going to provide that compare and contrast of how they were related and how they were different. Then you're going to go into another section of your paper. My suggestion would be to use level 1 headings for each of these sections. So the next section of your paper is looking at your interventions. So let's say you had 6 articles on your intervention, and 4 of them all agreed that the intervention was financially a good idea and save patients time in the hospital. And they all 4 agreed on that. Then you had 2 that said something different, but still said that the intervention was really good, but they had a different take on it and they were similar. You're going to use the next section of your paper to compare and contrast the articles related to your findings related to your intervention. So you've got a section on your controls, doing that analysis. Then you got a next section that's going to be on your interventions that's comparing and contrasting things that are similar. Within these sections of the paper, you're going to be using level 2 headings. If you start it with a level 1 for these sections, you're going to use level 2 to break up the similarities and the differences, or maybe different topics that were similar or different. However you want to organize it. In these sections, you need to be using 2 levels of heading. You're also likely to be using combined in-text citations, and that occurs when you are you're looking at articles and you're finding that multiple articles find the same thing. So you're going to use those articles, and you're going to use a combined in-text citation saying these three independent works agreed on this concept. So remember when I said those 4 authors said that your control saved money and decreased patient days? Well, let's say that your authors were Jones for one article, Smith for another article, Johnson and Jackson on the third, and then I'm making up names here, Hudgens and Little on the next one. You're going to put those independent articles in an in-text citation and separate them by semicolons. And I'm going to walk you through the Purdue OWL to show you the format. If I explain it to you, I'm just going to cause confusion. It's an expectation to use the combined in-text citations within the body of your paper. So level headings, and then your combined in-text citations. I'm going to show you, first this is the Purdue OWL site. So you are going to, sorry, I'm looking for, okay. This is the Purdue OWL site. You're going to hit the APA guide. And then on the side, you're going to get your selections. So under APA, you're going to look for formatting and guidelines. And then down here, you are going to look for, there's your in-text citation, in-text citation by authors and authors. Okay, so here is citing by authors or authors. About 3/4 of the way down here, 2 or more works in the same parentheses. That is a combined in-text citation. And you can see that you put the works in alphabetical order by their grouping. So don't reorder. If you have 3 authors that are Smith, Jackson, and Brown, you don't change that group of authors if they belong to one citation. But if you have like 2 different citations within that combined in-text citation, you put them alphabetically by the first author with the year that they were published and then the semicolon. And this gives you the format for that. So know that that's here. The other thing to be mindful of is that we have your sample paper is also in this section. So your APA sample paper can be found here. So if you're looking for reminders on how to use those level headings, your sample paper will guide you. So I don't want to make you dizzy. Do not put your abstract on this section again. Remember, that's the last thing you do. So skip the abstract. Here is page 1. There's a literature review, which would be an okay heading for you to use for your analysis. And here, sorry, I don't want to make you dizzy. There's your discussion. And this is where they begin to use the in-text citation, the level heading. So this is an example of a level 1 and a level 2 heading. Technology limitations, that's a level 3 heading. You always use them in sequential order. I'm not going to go through the paper. We've done this together as a group. I just want to remind you that it's here. The other thing I want to remind you is APA has not included the DOIs because this is the source that Purdue uses is the first edition of the 6th version. So they have not included your DOIs. That is a current expectation with APA. So you can see here in these articles that they're missing their DOIs. So if I want to find out where their DOIs are, I can copy in a citation and I can use the Crossref .org website to find all the missing elements. So let's take Underwood and Finley. And I'm going to highlight those and I'm just going to control copy. And I'm going to go over here where Crossref, this is under your Blackboard site. It's just crossref.org. You can open the search field and I'm going to control V. I just dropped it in. So all I'm doing is copying it. I'm hitting enter. And this is looking through all the available databases for the articles that are available that have had DOIs associated with them. And it's the first one that comes up. There's the internet relationships and their impact on primary relationships. There's the DOI. So all I'd have to do is just copy this and go back into my reference and drop the DOI in there. Remember, with an HTTP, you don't put retrieved from or put DOI in front of it. You literally just copy it. It's also a really good place if you can't find the volume or issue, or you're not sure which is which, go online and look, use Crossref, and it will tell you. This says that it was published June 2004. The volume is 21, the issue is 2, and there are the pages. So if you're missing, when you clean up your reference list and you're missing a detail, this is a great way to find the missing details. Now, if you come on here, you find the article, and let's say there really isn't an issue number, which is not uncommon for articles, for periodicals that are not published frequently. That may be the case, but this is a way you can find that out. Okay. So we've talked about the comparing and contrasting. Then you're going to have a section on your paper and you're going to answer your PICO question. You're going to say, according to this information we found, this is the answer to our PICO question and this is the recommendation. The next thing you're going to do is you're going to talk about limitations. And again, this is another section under your paper. How you organize it, it's up to you, but you've got to address the limitations. And when we think about limitations in articles, what we're looking for are things that are inherent to the article that make them hard to generalize to bigger populations. So let's say you found 5 articles on your intervention, but they were all really small sample sizes. No one had a sample greater than like 20. One of the limitations would be the sample size. Let's say that 2 of your articles of the 5 you found were funded by durable medical equipment companies because that was where a grant was available. You need to say they may have been invested in the findings of our research or of the author's research. Take the time. Your book does a good job of talking about limitations. I don't want you to get really lost in the weeds on this because you could make a whole section of a paper talking about the limitations and bias of sources. I do want you to be looking at just the general topics of looking at sample size, looking at generalizability, looking at your population. Did your articles all talk about older women over 65 and what you really want are adults, all adults, male and female over 65? Make sure that what you found can be generalized to make a decision on. That's what I want for you to look at for limitations. Again, go into your textbook and read the section on limitations to get clarification on that. And the last thing is you're going to clean up your reference list. Everybody on your group has someone that did a really good job on your reference formatting in APA, on your annotated bibliography. So find out whose articles did really well because I said, hey, this is exactly correct, and have that person go through and double check everyone's APA before you submit your final paper for part 3 so that you are not continuing to make the same mistakes. When I look at a reference list and I see several of them are done really well and then several of them are not done well, normally what that means is that whoever's coordinating the paper has put it all together and one set of eyes has not proofread it and made sure that all the smaller details have been addressed. I don't want you to get tangled up on that. Some people, this is tedious and it does take time and it's easy to make mistakes. That's the reason you need to kind of look at your strengths within your group and figure out who's really good at this. And either that person needs to mentor people that need to grow, or they need to take the responsibility and just say, okay, this is something I'm good at. I don't mind doing it. Let me take this on and I'll be our APA checker. However you want to negotiate this, there's somebody in every group that can do this and do this well. So I feel good about that. Guys, I know this is tedious and I know this feels like it is taking forever. And if you're having to repeat a piece, then that's even more frustrating. You're learning and it is okay if you're having to repeat a step. That's how you're going to remember how to do this. Do not hesitate to ask me questions. Come see me during office hours. If my office hours are not convenient, I will try to juggle them to meet you. But if you're not telling me there's a problem, I'm not going to know. You are not alone in this. So if you ever feel like you're guessing, please don't. I can't proofread your work. I can't go, yep, this is a great article, or you've addressed all your APA mistakes. That's just not something I can do. This is great at work. But I can answer can I use this source because this may be an issue? I've done this citation, this one citation. Is this what you're looking for? I can do those small things. I can't do the whole kind of overview and double check. Okay. Know that I'm here. Let me know if you have questions or concerns. I will look forward to seeing either revisions or final drafts this week at the end of the week in Blackboard. Hang in there, guys. We are about halfway through. Take care.